Well, civil society groups are pushing for domestic funding to reduce the incidence of HIV/AIDS in the country. UNAIDS report reveals that the current statistic for HIV prevalence in the country doesn't look good. 190,000 new cases were recorded between 2017 to 2018, a situation that health experts say is worrying. At a global HIV conference in Accra today, the civil society group said unless funding from various governments is increased, the prevalence would keep rising, making it impossible for countries to stop or reduce new infections by 2030 as targeted.
300,000 people are living with HIV/AIDS in Ghana today. This number, according to the Ghana AIDS Commission, is worrying, considering the numerous interventions that have been put in place to curtail the menace over the years. The health experts from more than 40 countries who gathered today shared ideas on how to reduce the rising trend in sub-Saharan and West African countries. The Director General of the Ghana AIDS Commission, Chireme Etuahini, mentioned Ghana is introducing a self-testing procedure as one of its measures to deal with HIV/AIDS.
Ghana AIDS Commission has taken a policy decision to introduce self-testing. And as soon as we are done with the paperwork this year, self-testing will start in Ghana.
Executive Director of NGO Hope for Future Generations, Cecilia Lodonu Seno, was not happy that civil society groups, who mostly deal with the youth in deprived areas, are not adequately resourced to assist in the fight against HIV/AIDS.
So the issue of funding, how bad is it? Joining us in the studio is the head of clinical care at the National AIDS STI Control Program of the Ghana Health Service, Dr. Nyonuku Akosua-Badu. We're going to find out from her how we got here for 5 years. But just a quick correction, and Doc, you're welcome to the studio. Just a quick correction. So the figure is not 190,000 prevalence cases being recorded. It's actually 19,000, which is still alarming, yes, by the way. So how did we get here?
Well, you know, the first case of HIV was reported in Ghana in March 1986. And since then, the disease has spread. People have become aware of it and report to hospitals, and then mostly we've been doing diagnostic testing. And when I say diagnostic testing, people who come into the health facilities with signs and symptoms of HIV are tested, and then the disease is picked up and then they are managed. Now, once you are positive, you need to be on treatment, and medications are available and they are given for free.
Okay.
So
but does it mean that people don't know this? Because one would have thought that at this point we should be recording some successes like we've done with malaria.
Yes. You know, there's a lot of stigma around HIV, so people hide their statuses. They don't want anyone to know they are HIV positive. So some people come to the clinics, they are started on treatment, but because they have to keep coming, they stop looking for a cure. And you know, with HIV, when you're on your medication, you stay alive and well. But when you stop, the virus begins to multiply again, then you fall sick and can die.
One of the clear issues that have been raised here is funding.
Yes.
How bad is it?
Yes, okay. So the Global Fund for AIDS, TB, and Malaria, which was started by our own Kofi Annan of blessed memory, they have been supporting the funding of HIV care in Ghana. But gradually, our government is also stepping in. Now, our government has bought test kits, so many test kits for us, over 200,000 test kits, and they are also procuring antiretroviral therapy for us. That is the medication that we give to people who have HIV. So government is stepping in. And, you know, now we are moving towards Ghana Beyond Aid.
So
and
they
our
say.
Donors to reducing their funding.
Exactly.
Yes, because they want us to be responsible.
Besides, we say
funding.
we're a middle-income country already, so there we are. Going forward, and I've run out of time, unfortunately. Going forward, what are the things that the organization require, you know, to make this fight against HIV is a much more successful one?
Yes, you've asked a very important question. You know, we want the stigma against HIV to disappear. Someone has HIV and immediately people look at you in a funny way. Oh, you also have that disease. Hey, where did you get it from? You know, those comments already, the person feels sad and miserable. So there's stigma. See, if there is no stigma, people will boldly walk into a health facility, ask for an HIV test, and if they are positive, will go for treatment and be, you know, ready and
especially in a country where there is this hypocritical moral compass everybody seems to have.
That is what is fueling the stigma, that the moment you're HIV positive means you were promiscuous.
Yes.
But it is not so. We have mother-to-child transmission, we have people sharing sharps and all that. So there are various ways people get infected. But once infected, start treatment and stay on treatment.
Once infected, start treatment and stay on treatment. I wish I would have a lot more time to go into this so we can encourage some people out there. But it's all good. It's not about the quantity, basically about the quality. So I hope that this information is quality enough for you to go out there. Doc, thank you so much for coming.
Thank you.
Dr. Nyonuku Akosia-Badu is the head of clinical care at the National AIDS/STI Control Program of the Ghana Health Service. Get tested, know your status, and get some treatment for it, as you saw in the hotline documentary we brought you yesterday as well.